With CDK4/6 inhibitors, which now have been approved by the FDA in first-line therapy, overall the drug is well tolerated. There is one big side effect, which is myelosuppression. So these patients do often get a drop in their white blood cells, red blood cells, and platelets, more so on the white blood cells. Typically that tends to be asymptomatic. It's very rare that they get into trouble with febrile neutropenia, but nevertheless, there's always the risk and the potential. There's not much in terms of GI side effects. So overall, the drug is well tolerated, doesn't cause that much fatigue. So quality of life really has not been a huge issue with a drug such as palbociclib, which is the one that is approved right now. With drugs such as everolimus, which is also approved for second-line and above treatment of estrogen-positive metastatic breast cancer, the side effect profile is not that great as it is with CDK4/6 inhibitors. You end up seeing a lot more rash, GI toxicities, stomatitis, although those are fairly easy to manage. And some of the rare side effects like pneumonitis are not really that common. But nevertheless, every time you add more drugs to endocrine agents, you will have a little bit more in terms of side effects. So perhaps the price that is paid to have a little bit of a longer progression-free survival is a little toll on overall quality of life. Not a big toll, but a little bit of a toll. But for the most part, side effects are manageable, and I think oncologists are learning more and more how to manage the low blood count that is really asymptomatic and doesn't have any clinical implication versus some of the GI toxicities that we may see with stomatitis, but not. I mean, those are not terribly complicated. They're not really that much different than what we manage some of the chemotherapy side effects. So for the most part, it's actually quite doable.